Well, some good news for those who are nervous about the potential side effects of the booster shots. A new CDC report shows the side effects with a third dose tend to be mild or moderate and short-lived. The Fox Medical team's Beth Galvin joins us live to talk more about this. And Beth, this report is some of the first Americans to get a third shot. What do they say?
Christine, they said that that third shot that they got was a lot like the second shot that they got. And as you said, this data is coming from the first people in line to get a third dose of an mRNA vaccine. And this started in the middle of August. And those are folks who are immunocompromised. So they were given priority for these third doses. And just over 22,000 of those folks who got a third dose shared their side effects through their smartphone as part of the CDC's V-Safe vaccine safety surveillance program. And of those who got that third dose, they reported 3 frequent side effects. So 71% of them said they had injection site pain with that third dose, 56% reporting fatigue after that third dose, and 43% say that they experienced a headache after they got a third dose of the vaccine.
The frequency and type of side effects were similar to those seen after the second vaccine doses and were mostly mild or moderate and short-lived. If you are eligible for a vaccine booster and you have questions, I encourage you to go to vaccines.gov, talk with your healthcare provider, pharmacist, or a health professional about your current risk for COVID-19, the benefit of a vaccine booster dose, and the safety of receiving an additional dose.
And about 55% of Americans are now fully vaccinated, but about 70 million adults and those over 12 who are eligible to receive the COVID-19 vaccine have not gotten their shots. And the CDC is recommending that if you are in that group where you've already been fully vaccinated with the Pfizer-BioNTech vaccine, that's the only one right now where they're giving out booster doses. If you want to wait until you are 6 months out from your second dose of the vaccine before you try to go and get your booster dose. So you do want to check your vaccination card and make sure that that second date that you got your second dose on, you've waited then 6 months. So just do the math and figure it out. But that means a lot of people, Christine, are going to be coming up eligible this fall who were vaccinated in the spring.
Yeah, I remember, Beth, when the first set of shots came out, that when people got the second dose, that they felt pretty bad after that. So what was the case with the third shot? Yeah,
so the data when you really tend it sort of hits you, at least from my personal experience and from what I've heard from others, is the day after you get vaccinated. And in this report, in the folks who got that third dose, it basically held true. They said, the day after they got vaccinated, 28% say they had a difficult time, doing their normal daily activities, at least, and it was most common that they would feel that way the day after they got vaccinated. Typically, the good news is, though, that that wears off and you tend to kind of rebound on day 2 after your vaccine. But, it can take a few days to sort of resolve. But many health officials and doctors have said that's a sign that the vaccine is working because your body's reacting to it. Christine?
Okay. We will see if people really step up and get this booster shot. All right. Thanks so much, Beth.